Strengthening for Legg Perthes by Matthew Lucena and Christopher Parks. So, Legg Perthes is the avascular necrosis of the femoral head. So this happens when blood supply is lost to the ball of the femur, and then it results in collapse, as you see. So the femur of the ball of the femur gets almost collapsed and shortened. So due to that, you may see a shortened limb on the affected side, and the patient will be be displaying a limp. It's seen more in adolescent males, and the pain will be worse when they have activity and then better with the rest. Um, Also seen with this will be decreased abduction on the affected side. So at Pete's clinic, I actually saw a patient a few times that has Legg Perthes and had surgery for it. So he also fit all the demographics for kind of the typical patient that you would see that has Legg Perthes. So most recently in the last session, he said that he's complaining of deep hip pain again, and I saw that he was limping, which was not too good. So it'll be interesting to see kind of where he's at, or if there's any kind of relapse or any recollapse of the femoral head. He said he was running and did quite a bit of activity before, and the pain is now present again. So I can kind of keep you guys updated with that and see how his progression goes. So for the intervention, it really depends on the patient. So the age of their patient and the severity of the collapse. So in general, younger patients have a better prognosis than older patients. So for those younger patients, you may want to just modify activity, limit any pounding, such as running or physical activity that's really hard on the hips. You also may be having some bracing options or casting options, and then also surgery may be indicated. In the research, there also has been some medications that have been looked at to help prevent the ball of collapsing. So there's future research on that being done. So in this study, we're looking at how physical therapy can affect the range of motion in the hip of a patient, either with surgery or without surgery. So hip abduction range of motion is very important in the treatment and also for surgical outcomes.
Data from this study was collected from a Swedish database of children diagnosed with Legg Perthes from the ages of 2 to 12 years old. The database had a total of 192 patients, and within those patients, 199 hips were analyzed. Range of motion for abduction was taken by physical therapy, and recorded changes were discovered over time and calculated for. Any other relevant information regarding hip abduction strengthening and interventions were also taken. This flowchart kind of represents the patients within the database. So like I said, there was 199 hips analyzed in total and 192 patients. These people received some surgery, and then they may or may not have gone through physical therapy with a focus on hip abduction strengthening. So there was 126 people in PT and 73 hips that were not in PT. And then after that, some may have received a secondary containment surgery, and then they were also given a 2-year follow-up. Changes in abduction range of motion were measured throughout and recorded. So what did the data show? So the data showed that on average, the initial abduction range of motion after surgery was about 39 degrees. There was no differences shown between boys and girls in the abduction of the affected hip at diagnosis or the 2-year follow-up. Younger age was shown to be associated with a better range of abduction between diagnosis and a 2-year follow-up, so that younger patients showed a better range of improvement overall. And then loss of abduction was less in those who received PT over those children who did not receive that hip abduction PT. So this chart compares changes in abduction range of motion between diagnosis and 2-year follow-up, and for those who had PT and did not have PT. So overall, the average for those who had PT, they had a better increase in hip abduction to those who did not have PT. This chart kind of more easily shows the kind of progression or in changes of your hip abduction as you go through different stages with Legg, Calve, Perthes. So from diagnosis to surgery, you can see that with those who had PT and then those who didn't have PT, there was a much greater change in abduction. And then even after surgery into the 2-year follow-up for those who had PT, even though that average is still the same between PT and no PT, the range is much higher, especially when you can get a potential over 40 degree change of hip abduction positively.
Okay, so stay tuned for our video. We're going to show the intervention at the end. Here are our references. But in the next video, it's going to be shown a
So you gotta make sure that your
general
back
hip
is
abduction
straight.
strengthening exercise.
You're gonna stop when
Great
you open
introductory
your legs.
exercise, kind of going, laying on the
And
ground. So you would
exhale.
progress this by
And
possibly going on the side,
slowly.
doing side lying, abduction,
4,
and then maybe adding a
nice and
band
slow.
or doing clamshells
5,
or stuff like that.